it's amazing to see this wonderful turnout here today. As you said, am the nurse practitioner at the Bing Center for Waldenstrom's Macroglobulinemia in Boston. And I'm going to be talking to you today about one of my favorite topics to speak to patients about, and that's just personal survival strategies, self-management, keeping fit, addressing fatigue, and optimal diet. So as you know, Waldenstrom's is considered to be an indolent lymphoma. It's something that most patients do pretty well with, and it has an association with the prolonged survival. And this is actually improving with the new treatments that we have. So there was a couple of studies presented at our international workshop here by the researchers. One was looking at relative survival improvements over the last decade. And the 5-year relative survival, and relative survival is defined as an observed survival divided by expected survival for the general population in a specific calendar year. So between 2001 and 2010, the 5-year relative survival rate is 78%, and the 10-year relative survival rate is 66%. So that's improving, and I think we can thank some of our new therapies for that. And we are expecting to see further in survival in Waldenstrom's patients. There's another paper that was presented at this workshop, and that had to do with looking at symptomatic Waldenstrom's patients and how they do over the years. So what this study showed that in this 5.5-year follow-up, that the patients who did die from Waldenstrom's, 23% of the deaths were unrelated to Waldenstrom's. And for patients who were over 75 years old, the unrelated deaths were 40%. And if you look at the overall medical conditions like coronary artery disease and stroke, those rates are relatively similar between the general population and Waldenstrom's. So the main point there is just it's really important to take care of yourself and your overall health and not to be defined by the diagnosis of Waldenstrom's, and that there's a lot that you can do to feel better and to improve on how you do with your symptoms. So the agenda is just the self-management and keeping fit, addressing fatigue, and optimal diet. And as you'll see, many of these interact with each other. So this is the American Cancer Society guidelines on nutrition and physical activity for cancer survivors. And a survivor is basically from the time of diagnosis through the whole balance of your life. So, and this really applies to anyone. It's not specific to America or to even to cancer patients. So these are the three main things. It's achieve and maintain a healthy weight, engage in regular physical exercise, and achieve a dietary pattern that's high in vegetables, fruits, and whole grains. So when we look at nutrition goals, they can vary a little bit between active treatment and time periods where you're on a watch and wait, or when you're not receiving active treatment. So during active treatment, really the goals are to prevent or to resolve your nutritional deficiencies, to maintain a healthy weight, to preserve your lean body mass, to minimize nutrition-related side effects that can be a result of nausea, vomiting, or diarrhea from chemotherapy, and to maximize your quality of life. And we also really do advocate for dietary counseling during cancer treatments. And we advocate that the nutritional assessment should begin as soon as possible after diagnosis and should keep in consideration what the treatment goals are and focus on both the current nutritional status of the patient and the anticipated nutritional related symptoms. And the dietary counseling is associated with improved outcomes during treatment and fewer treatment-related symptoms, improved quality of life, and improved dietary intake. And if possible, to utilize someone who's a registered dietitian with a specification in oncology. And then just looking over dietary guidelines, again, this is general, but you want to kind of keep this in mind. So 2 to 3 cups of vegetables a day, and 1.5 to 2 cups of fruit a day, 5 to 6 ounces of grains a day. At least half of those should be whole grains if you can, and then 5 to 6 ounces of proteins a day, and 3 cups of dairy, 5 to 6 teaspoons of oils. And you want to restrict foods that are high in solid fats, added sugars, and salts. And also think about what your specific caloric needs are and portion sizes and serving sizes. So this is just looking at what counts as a serving, because that can be a little bit confusing. So one serving of fruits and vegetables can come from a cup of leafy greens, berries, or melon chunks, a half cup of all other fruits or vegetables, a medium-sized fruit or vegetable, a quarter cup of dried fruit, or 3/4 cup of 100% juice or fresh fruit. So actually the FDA is actually looking at new labeling to hopefully make it a little bit less confusing when looking at food labels. And they are going to be differentiating how much is added sugar versus natural sugar. And just for comparison, 1 soda a day is basically equal to about will meet your 8 teaspoon limit of added sugars. So it's easy to do that. Versus if you eat an apple, you can get the fiber and also the complex carbohydrates you need from that. And it also helps you to digest it better. So what is an optimal diet? And there's just some guidelines here too. And these are based on consensus criteria from the NCCN guidelines for survivorship in patients and various other organizations. So for proteins, carbohydrates, and fat, these all contribute to energy to the diet. In protein, you want to have about 10 to 35% of your total intake, and a goal of about 0.8 grams per kilogram. And for carbohydrates, 45% to 65% of the total intake, with a high intake of fruits, vegetables, and whole grains. And for fat, 20 to 35% of total energy intake, with saturated fats less than 10% and trans fat less than 3%. And also to remain adequately hydrated, and as long as there's no contraindications. For women, 2.5 liters, for men, 3.5 liters, and much of this is gained from food as well. This is just showing you the body mass index, and this is what can be used to get a general idea if you fall into a healthy weight, an overweight, or obese category. So for a healthy weight, you want to strive to maintain a BMI between 18.5 and 25 milligram per meter squared, and that's in this category over here. And just going to move on to talking about obesity. Obesity is associated with an increased risk of many cancers, including non-Hodgkin's lymphomas. There's increased risk of recurrences and a decreased likelihood of disease-free survival. And an association with type 2 diabetes, which is also associated with obesity and metabolic syndrome, has an increased risk of many cancers, including lymphomas. It's actually overtaking tobacco as the leading preventable cause of cancer. So this is one thing that you can do to help prevent a secondary malignancy from happening. This is looking at obesity's link to cancer. And in men, you see here that obesity is linked with head and neck, esophagus, pancreas, kidney, colon, rectum, and prostate cancers. For women, it's also head and neck, esophagus, but breast as well, pancreas, kidney, colon, rectal, and endometrium cancer. So in 2007, there was more than 84,000 new cancer cases were attributed to obesity. And the percentage of cancer cases attributed to obesity varies, but again, 40% for some cancers. And 1 in 5 cancer-related deaths were attributed to obesity or being overweight. So there's a few mechanisms to this, and one is having to do with increased levels of insulin. So insulin-like growth factors in their blood can promote the development of certain tumors. And then obese people will also have a chronic low level of subacute inflammation. So inflammation is also known as a cancer risk. And then the fat tissue itself can be involved in development of certain obesity-related cancers, including estrogen-sensitive breast cancers. And they can have an effect on the tumor growth regulators. And there's another paper that just came out this week out of the Lancet on August 14th, and this was a UK study, so I thought it would be appropriate to mention it here. And this one looked at a population-based study. So it included looking at the primary care data from individuals in the clinical practice research data link, and it looked at their BMI data. And this had 5.24 million UK adults. And they found that the BMI was associated with 10 cancers, and it's very similar to what we see here. So those 10 cancers include the uterus, gallbladder, kidney, cervix, thyroid, and leukemia. And there was a positive association also with liver, colon, ovarian, and postmenopausal breast cancer. And 41% of uterine and 10% or more of gallbladder, kidney, liver, and colon cancers can be attributed to excess weight. They actually show that this had a linear relationship, so each 5 kilogram per meter squared increase in BMI was roughly linear and associated with these types of cancers. So going on to dietary supplements, I do get a lot of questions about these, and there's a lot of information out there, or I should say there's a lot of misinformation out there as well. So the consensus criteria here is between many cancer experts. They really, at this time, are advising against taking supplements during and after treatment, unless there is a need to treat a specific deficiency or to promote another aspect of health, such as osteoporosis or macular degeneration. There's conflicting data, and sometimes they're shown to be a non-beneficial effect from certain supplements. And they show that it's unlikely to improve prognosis or overall survival after the diagnosis of cancer. But if you are going to take them, they recommend to avoid supplements that exceed more than 100% of the daily value. And specifically in Waldenstrom's, there is some questions around supplements helping with peripheral neuropathy. And there's some data out there that are, again, conflicting, and there's really kind of a lack of support. One in particular is alpha-lipoic acid for neuropathy, but I do have several patients say that it is helpful, and we don't have evidence necessarily that it's harmful, but again, just a general lack of support. Special considerations, specifically for Waldenstrom's. So if you're on a bortezomib-based therapy, Velcade-based therapy, the ingredient in green tea may block the anti-cancer activity. So this is the time when you want to avoid green tea. And there are specific dietary considerations for patients taking ibrutinib. So the way that ibrutinib is metabolized in the body, patients should avoid grapefruit juice, Seville oranges, and star fruit. These fruit juices will increase the concentration of the drug in the blood. And also to avoid fish oil supplements because of the blood thinning effect, and ibrutinib is associated with bleeding. And also to avoid vitamin E supplements. So that's just specifically for ibrutinib. And then there's the issue of iron deficiency and anemia, which is fairly common, and this is related to an overproduction of hepcidin, and that blocks the oral absorption of iron in the gut. So a lot of times iron pills are not effective therapy for iron deficiency in Waldenstrom's. So we have to utilize intravenous iron to help overcome that blockade of oral iron absorption imposed by hepcidin. Okay, so moving on to, I don't know. Oh, here we go. So the physical activity guidelines. And this, again, applies to everybody, not specifically to cancer patients or to Waldenstrom's. And that's to get 150 minutes of exercise of moderate intensity aerobic physical activity a week, which is 2 hours and 30 minutes, or 75 minutes, which is an hour and 15 minutes a week of vigorous intensity aerobic exercise. And also to combine that with muscle strengthening exercises that are moderate or high intensity and involve all major muscle groups on 2 or more days a week. And you don't necessarily have to do one or the other of the moderate intensity or the vigorous. You can combine these to be an equivalent as well. And the health benefits of the muscle strengthening, of course, are improvement in muscle strength, endurance, improvement in functional status, and maintenance and improvement in bone density. And joint and multi-joint exercises all help with this. And these are just some examples of what are some moderate activities and what are some vigorous activities. So moderate, you can think of that as I can talk while I do them, but I can't sing. Vigorous, I can only say a few words without stopping to catch your breath. So that's like running and aerobic dancing, biking, hiking, and things along that list. Exercise benefits cancer patients during and after treatment, and there's been multiple studies now looking at this. It helps to improve physical functioning, it improves survival, it lowers the risk for certain cancers, like I showed with the obesity link as well. It reduces anxiety, fatigue, and pain, and improves cancer-related fatigue, and it has a beneficial effect on a number of health-related quality of life domains, as well as improving your cardiovascular fitness, your muscle strength, body composition, and self-esteem. There are some exercise modifications to consider for severe anemia, and if you have that, it's better to delay exercise other than the activities of daily living until the anemia is improved. For a compromised immune function, if you're on a therapy such as bendamustine, this can lower your white blood cell count or your neutrophil count, which are the infection-fighting cells. So if that's the case, if you're neutropenic, you want to avoid public gyms and public pools until your white blood cell counts are within a normal, within a safe range. And then if you have severe fatigue from your therapy, it's just better to do modifications as needed, even if it's just 10 minutes of light exercise a day or what you can do at that time. Or multiple or uncontrolled comorbidities, modifications to the exercise regimen in consultation with your care team. And then with peripheral neuropathy, this also, you can modify therapy as needed, such as using a stationary reclining bicycle rather than walking on a treadmill, or doing water-based exercises, maybe rather than using an elliptical or something that might aggravate your neuropathy symptoms. So managing fatigue is fairly common through all stages of active treatment or during watch and wait times as well. And there's several factors that contribute to this. One is just a deconditioned state, especially for patients who are on a therapy or if they're going through that initial phase at the beginning of their diagnosis where they may be having some B symptoms. So that's what Dr. Kyle was saying about night sweats and fever and weight loss. Anemia also contributes to fatigue. Medications, sometimes medications that we use for neuropathy can cause some sedation or fatigue. And pain, same applies for the pain medications. And fatigue can be from the emotional distress, just from dealing with this diagnosis or dealing with whatever therapies that you're on. And sleep disturbances is pretty big, so just not getting that quality sleep that's needed. Nutritional deficiencies or imbalances, comorbidities, and also just depression can be a big contributor as well, and anxiety. So it's important to recognize what may be the cause of the fatigue, and a lot of times it's more than one thing, and then to look at what you can do to improve on those causes. And it's important to maintain a healthy lifestyle. So we tell patients to minimize alcohol intake. There is some studies that show the cardiovascular benefit of maybe 1 to 2 drinks of wine a day, but beyond that, there's not really any extra benefit, so you don't get extra credit for 5 or 6. Avoid tobacco products, and that's obvious. We know a lot about that in malignancies. And practice sun safety. So in Waldenstrom's, there is an increased risk for skin cancers. So it's really important to make sure you're wearing sunscreen and make sure that you get abnormal lesions checked out and that you are very diligent about that. And adhere to your age-appropriate health screening and preventive measures and cancer screening recommendations. And also in Waldenstrom's, we've done a study that looked at secondary malignancies, and along with skin cancers, there's also an increased risk for breast cancer in women and prostate cancer in men. So we do ask patients to make sure they're continuing to get their mammograms and their prostate screening done. It's important to also think about other therapies that may help, and these are some of the things that we have available at our Integrative Health Center at Dana-Farber, but it's also available in other areas, such as acupuncture, massage, meditation, yoga. But another important aspect is support groups in these educational forums and counseling, and utilizing community resources. And now there's also more information about cognitive behavior therapy, and that's been shown to be useful in decreasing anxiety, depression, and sleep-wake disturbances. Okay, and that's all I have. Okay, so that's all. Thank you.